Kumar Menon here. As usual, my topic will be related to health insurance. So today, I have dealt with many topics earlier. So today, I'll be mainly concentrating on TPA activity. TPA, as you know, means third party administrator. That entity is the is looking after all insurance related issues. So these days, I don't have to tell you, everybody is very conscious about the need for having health insurance. Growing cost of Medicare, medical facilities, and also increasing sense of insecurity, financial insecurity, maybe other insecurities are also there, health insecurity. This has grown among the public, and hence the need for health insurance is growing at a very fast level. So coming to TPA, I'll be concentrating mainly on TPA activity only in this presentation. TPA is an intermediary. They are an intermediary between the insurance company, let it be nationalized insurance companies or maybe standalone insurance companies. Then policyholder, in between stands the policyholder and also the healthcare provider, that is the hospital. So all these three factors, they have to be monitored, mentored by the third party authorities. There are about 27 TPAs in India, but practically all of them are not functional. Practically, there will be around 19 TPAs which are active in the field. Here, I do not make any distinction between public sector insurance companies and private sector or standalone insurance companies. Coming to the key functions of the TPA, the first one is claim processing. It can be claim processing related to cashless hospitalization, reimbursement procedures, customer support. The TPA has to ensure that customer support is given to the insured. Medical records management, that is a very important thing. All the medical records are held by the TPA. This is not the case if in-house processing is done. That is a different scheme. I'll only shortly mention about in-house processing, as I am concentrating more on third-party administration and their management of medical records is very important. Fraud detection is a very, very important issue now. As you might have read in many of the newspapers, hospitalization frauds are on the increase day by day. Crores and crores of rupees are defrauded by public. Other issues I'm not mentioning. It can be in many cases the hospitals also collude, but not in rare cases only normally. But this happens much less in Kerala. It is much more in many other states. So, issue of insurance cards. It is very important. If you are an insured person, you should have a ID card given by the TPA or the insurance company. The issue of the card is the job of the TPA. Then, another very important assignment given to them is empanelment of hospitals. See, as you might have seen, many insurance companies say they have 15,000, 18,000 network hospitals in India. Some insurance companies may have only 5,000. Normal, they say it is 9,000, 10,000, 12,000. It can vary. It need not be the correct assessment also, because this is all very temporary. The network status may or may not change. There are factors that induce change. So the more network hospitals we have, or the TPA, the insurance company has, the better, because the choice will be much more and it will be easier to get cashless hospitalization and other factors also. Then many forms have to be downloaded relating to health insurance claims. All these forms are available with the TPA. By that I mean it is available at the TPA website. You just have to visit the website and download. Mainly we download cashless request form, reimbursement forms, Form A to be specific in India, and Form B to be given by the hospital doctor. All these are the main papers required. These can be downloaded at the TPA websites. At this juncture, I will tell you, all the TPAs have their own web page. If you visit the page, you can get a view of what are the facilities offered. These TPAs, this TPA health regulation was passed in 2001 by IRDA. TPA should have a minimum paid up equity capital of 4 crores. That much fund is minimum required. I'm not sure whether it has been increased recently, but there is a chance that it will be increased shortly. Then, out of this, there should be, especially the director, at least one director should be a qualified doctor. The director board must have a doctor, qualified doctor. The CEO, Chief Executive Officer of the hospital, should have done a course in hospital management, and he should have passed the exam conducted by the Insurance Institute of India at Mumbai. Then he should also be having about 3 months practical experience in hospital management, in health management, and the TPA should have access to competent doctors, whether it be Ayurvedic, allopathic, or Indian medicine. They should have a panel of qualified doctors. These are the minimum requirements for a TPA to function. And all the TPAs have to be licensed by IRDAI, the licensing authority. To obtain that, offhand, I will tell you, it need not be the latest position. To get registration of IRDAI, 4 lakhs fee has to be paid by the TPA. At present, it is the public sector insurance companies that utilize TPA services most. Private, standalone, and foreign equity-based insurance companies, they have their own in-house processing centers, and also, in many cases, they engage TPAs. Coming to the nationalized insurance companies in India, New India Assurance Company Limited, I will just name them: United India Insurance Company Limited, Oriental Insurance Company Limited, National Insurance Company Limited, and of course, LIC. LIC is there both in the life insurance business and also in the health insurance business. These are the entities. Standalone insurance companies, mainly private sector health insurance companies, there are 28, approximately between 26 and 28 companies functioning in India now. To name a few, most of those who hear this will be familiar with the names because they do advertise much more than the nationalized insurance companies. To run through the names, not all, that will take a long time, and it is not, I feel it is not necessary. Aditya Birla, Care Health, Star Health, Bajaj Alliance, ICICI Lombard, Manipal Cigna, Future Generali, Tata AIG, ACO, IFCO Tokyo, Royal Sundaram, GoDigit, Aviva India are just, I'm naming only a few because otherwise the time will increase. Then coming to all the TPAs have their own mobile apps. It can be downloaded on desktop, laptop, or mobile. So about the app, it is very much required that you download and keep the app active on your mobile, because in emergencies and while you are hospitalized, it is a must. You can get almost all the services through the app. For that good health TPA, I am mentioning some of the important TPAs only now here. I mean, those TPAs with whom I am much more familiar, because in this insurance business, I have had to deal with about 9 TPAs frequently. So only those I am mentioning here. There are other things. It is the same. The procedure is the same. The apps are the same. The functionality is the same. Good Health TPA, that is a Telangana-based TPA, is one. The name of the app is Get Set Go. Get Set Go app. All these apps can be downloaded on iOS mobiles and also Android mobiles and other systems, as mentioned earlier. Almost all the apps contain the same matter. That is, it will have your member card, the TPA card, which you show at the hospital. You can track your claim on the app, which is very convenient. You can contact the TPA through the app without calling them. You can also, most of the apps have a senior citizen helpline data that also can be used by the senior citizens. There is a customer guide that details all the instructions that a user generally requires. In many cases, this being such a service, complaints will arise and you can express and record your complaints and send it to the third-party authority. Then another utility is hospital search. You can search and find out whether a particular hospital is there in the network hospital list. This need not be 100% dependable because the hospital list may keep on changing. It may be reduced, it may be increasing. Sometimes network status is taken out by it is a network. For getting network status, the TPA, the hospital, and the insurance company, they have to come into a joint agreement on rates, pollution control, facilities, number of doctors, so many things. So hospital search is made easy. Of course, I find practically, because I don't travel much, I locate the hospitals near me and see which all of these hospitals have network status with the insurance I hold. Then you can see, in case of reimbursement and other things, you are supposed to intimate the TPA that you are admitted to a particular hospital on this day, in this department, inpatient number, treating doctor's name, hospital details, how much time hospitalization is required, what will be the approximate amount, what is the course of treatment. Course of treatment could include investigations, medical treatment, surgical treatment, ICU treatment, tertiary care, secondary care, all those things, quaternary care. You have to mention that the TPA has to send the cashless request in case of cashless, informing the approximate cost and the details I mentioned just now. Then, in case you have multiple hospitalizations during a particular period of time, you can get the search, you can go to the search and obtain the records from the app. That is a very, that will show how much you have utilized, how much portion you have utilized of your insurance and balance remaining and other things. As I told you earlier, senior citizens are given a preference. There's a special desk for them to hear their matters. It is always better senior citizens deal with senior citizens helpline and not with the general helpline. Then these apps also differ. These are the basic features of the app, but some companies are into consultation, second opinion, even sale of medicines, and many other fields. That will expand their income source, and now the tendency is to enter various fields instead of confining the TPA activity to claim connected issues only. I will tell you some of the apps that contain the other details. There are other businesses also. Coming to the public sector, HITPA, that is Health Insurance TPA of India Limited. It is the one and only joint venture TPA. It is a joint venture between General Insurance Company of India, and the 4 nationalized insurance companies I mentioned before. Naturally, most of the nationalized insurance company business will go through this particular TPA, but that is not compulsory. They deal with many other insurance companies also. Medi-Assist TPA, that's a major, it is one of the biggest private sector TPAs in India now, based at Bangalore. They have all the facilities mentioned earlier, and they have diversified into medicine delivery. They have apps for that. The app is named, one of the apps, it is named MediBuddy. They have other WhatsApp support also, and AI, artificial intelligence support also. So they being the biggest private sector TPA, naturally offer more facilities like doctor consultation. You can arrange an appointment through the TPA, medicine delivery at concessional rates. It is also undertaken. Lab tests, they will arrange lab tests at home or at the lab. They will give a second opinion on your treatment and what is going on. Surgery care, they will offer expert advice on matters. They can be consulted, maybe all at a cost, but still those facilities are there. And that is where the future of the TPA is going to be from now on, because they will have to raise funds. To raise funds, you have to do business. To do that, you have to branch out into new fields. And that this Medi-Assist TPA is an example of that branching out. Recently, they acquired Reksha TPA. That was another big TPA, but I think it is in April. From January 1st, Reksha TPA was amalgamated with Medi-Assist TPA. So there is no Reksha TPA now. They have a combined help desk. Another TPA that also merged with Medi-Assist TPA is Paramount TPA. It was very active earlier, but now, that is even before January, around January, even before that, they merged with Medi-Assist TPA. So that is the reason why at present, Medi-Assist TPA is one of the biggest TPAs in India. They have, as I told you, a number of apps. You can go through that. The list is there. You can download it in Google Play Store or iOS Play Store. Coming to another TPA, MD India Health Insurance TPA Private Limited. Private Limited. Yeah. MD India is a Pune-based company. The name of their app is Hawk, H-A-W-K, Hawk Mobile App. That app also contains most of the details I mentioned before, so I will not go into repetition. Another Delhi-based TPA is Safeway Insurance TPA. They ought to have a mobile app that is called Safeway app. I will always recommend to you to download whichever insurance policy you are holding. Please do download the app. It will make it very convenient for you to deal with TPA and insurance companies. Another Delhi-based, it is actually Gurgaon-based TPA is Vidal Health Insurance TPA Services. It's also a very big company. Their app is called Vidal Health. They do handle a lot of TPA responsibilities. Another TPA is Ericsson Insurance TPA Private Limited, based at Mumbai. They also have an app available which has all the uses mentioned earlier. Heritage Health Insurance TPA Limited is a Calcutta-based TPA. So naturally, the eastern region, most of the hospitals will have TPA status with them. So that is another TPA. With that, I'm not further speaking on the TPA apps. Similarly, all private sector insurance companies in India, like ICICI Lombard, ACCO, Niva Bupa, all of them, about 28 I mentioned earlier, all of them have their own mobile apps. But the issue here is, what I have found practically is that the quality, the technology behind all these apps are not adequate enough or perfect. Being a technology field, some of the apps are excellent, they work well, they give all the details, but don't be carried away. That is not the way that all the apps work. I'm not specifically mentioning any TPA app that is not effective enough, because that will be a sort of discrimination. You only hope that all TPAs improve their apps so that it is user-friendly and not just an app that doesn't work. I'll come to the present challenges faced by the TPA. Weak hospital network is a big challenge. As far as possible, there should be more and more number of network hospitals. If the number is less, the customer will face the difficulty. To empanel hospitals is not an easy job. The hospitals should have certain standards. The hospital should be willing to be empaneled, and many other factors. I will touch upon these issues. Then the TPAs have high administrative costs because a lot of tech involved employees have to be there. Processing is all computerized. Rent, administrative costs, so many other things make TPA services expensive. That doesn't mean you have to pay direct to the TPA. That's not the way. Then that's an issue connected with the hospital also, because poor standard of billing coding, billing issues, billing problems, these arise. Also, to a certain extent, related to tech issues. These standards have to be improved. It is being improved day by day, but still many bugs do appear now and then, delaying the whole customer experience and what the customer expects from the TPA. Another thing making the functioning of the TPA difficult is low general awareness of the public on how to deal with them. See here, what I have found practically is that the customers keep on corresponding, keep on contacting the TPA repeatedly. Some cases it may be genuine, some cases it need not be genuine. And in some cases where complaints arise, they send complaint to the branch, to the head office, to all the branches, to all the executives, all the directors, everyone is roped in. That will not serve any purpose. Multiple emails sent consistently to all the officials will only further delay the issue. Please desist from that. Please understand the limitations of the TPA. This is one general issue I have found, because ultimately it is not the TPA that is rejecting your claim. It is the insurance company. TPA will pay the bill if it is as per their rules and as per the network hospital rules, they will pay the amount. But raising unnecessary issues with the TPA will only delay the settlement. In such cases, what I advise is, after exhausting all the resources, that is, there is a stage by stage escalation matrix for the TPA. After going through all that, and if still your issue remains unresolved, then without wasting further time, please do escalate to the insurance company level. Or in cases where a broker is involved, you can escalate with them. You can take up all issues with them, with the broker and the insurance company. I'm telling you this because it is known to most of the persons who have gone into litigation that you cannot proceed legally against the third party authority. You can proceed against the insurance company, you can proceed against the broker, but you cannot proceed against the TPA. That's why I tell you, you should not waste time corresponding with the TPA unnecessarily. After that, if your issue is not resolved, the final alternative is to approach the insurance ombudsman. 1, 2, consumer courts are there. 3, civil legal recourse is there. But I would recommend approaching insurance ombudsman first. That is, there is a gateway for that. They have a website. You can register electronically your complaint with all supporting evidence, and awards are handled pretty quickly, unlike civil courts where very much delay will be there. Another very a challenge for the TPA is that there is no mechanism to appraise their performance, TPA performance, based on customer satisfaction. Customer satisfaction is most important, but there are some changes coming in. From 2024, it has been revised. Now, each TPA is expected to get a customer appraisal sheet rating their services from poor to good, excellent, and things like that. That has been made mandatory. And slowly now, TPAs have started calling back and calling the customer and asking about their TPA experience, because that is now made mandatory. Still, it may take some more time for implementation. And another thing is their incentive, what they get should be linked with performance. The more performance, the more volume of transactions they handle, they should be able to get more remuneration. Now it is fixed. If my memory is correct, commission paid to a TPA should be around 5.6. From it has been there for a long time. The TPAs have been requesting to increase their percentage of remuneration, and that remuneration is paid by the insurance company. Please, it is not paid from your premium. Please notice the difference. Coming to the concerns the TPAs face, one is the concern is faced by the insured also, delay. There is delay when TPA is involved. But that is improving. The situation is improving. Recently, in 2024, turnover time, that we call that TAT time, has been decreased. For cashless claim, the decision has to be conveyed to the hospital within 1 hour. And when the discharge procedures are once on, and once the final bill is sent to the TPA, provided there are no queries, the settlement should be done within 3 hours. So the delay issue is being addressed. And in reimbursement cases, normally they require about 30 days time to process the reimbursement papers. That has also certain conditions. There should not be any queries pending. That should have been clarified. If that is there within 30 days, that amount, the reimbursement amount, should be credited to your account. In all cases, it may not be like that. Sometimes you may get the credit within 10 days, 5 days. Sometimes it may be delayed. And at present, Indian conditions, the average reimbursement delay is coming to around 120 days. That is on account of many reasons. One is ignorance of the insured. He will not be sending the proper papers, the required papers, and a lot of correspondence and goes on. And that is one of the reasons for the delay. The TPA may have its own reason for the delay. There may be manpower shortages, power shortages, leave, change of employees quick, because that is very much on the increase now. Then the second issue is lack of transparency in their settlements. Naturally, an insured person will not be knowing all the details about how much is due to him, what is the expected amount for each course procedure, and things like that. This lack of transparency will lead to billing issues and conflict. Normally, an insured person will say, I am insured for 5 lakhs. If the bill is about 5 lakhs, I should get the full 5 lakhs. But practically, that is not the case. He may not get the full amount. And so then we have to go in for litigation and for further clarification. All this take time. So that lack of transparency is a big drawback. Then coordination issues with hospitals. Always, all hospitals need not have cordial relations with the TPA, or maybe even these days even with the I should not say it, but so I'm leaving it. That lack of coordination affects the TPA performance, and hence quality of customer service will also vary from hospital to hospital, from TPA to TPA, and there is no immediate relief for that. Gradually, things will improve. I'm not going into the details of an alternative to TPA service, that is in-house processing. Whether it be in-house processing or whether it be TPA processing, mainly what is found now is in-house processing is quicker, is comparatively quicker. It need not be the case, especially the older generation people will find it difficult to get their insurance cover serviced through apps and new generation insurance companies because of age-related issues. Another thing, see, TPAs cannot make a judgment. They can either reject a bill, giving the reasons, or they can pass the bill. They cannot judge whether a particular claim should be paid or not. They have no role in that. That role is for the insurance company to decide. So, where cases of gray area issues may be there, so in such cases, the TPA may require clarification to be given to them by the insurance company. And that's why one of the reasons you find there is a delay in payment processing and such other issues. This is not a comprehensive review. It's a general review. So I'm not going into the intricacies because I feel that will be better. And let us try to maintain a positive attitude and appreciate the efforts taken by the TPA all over India, in all cities, to ensure better service to the insured. The new landscape is changing. The insurance landscape is fast changing. Now, recently, IRDAI is planning some changes so that the insurance scene in 2047 will be entirely different from what it is now. They have framed a regulatory sandbox for bringing in innovation to the insurance field that will contain databases, wide varied databases, performance appraisal, and also the present batch-wise processing of proposals. Batch-wise processing of proposals is to be replaced by continuous clearance of proposals, and that too, to the extent possible, to make it paperless, to make all the offices paperless. Easy to say, but in course of time, naturally, that will be implemented because there is going to be a national exchange where all the patient details, all the patient data will be available on this health exchange, and interaction between TPAs, insurance companies, hospitals will be much easier. Those days are not far off because technology change is very much there. At the same time, human resources issues are also there. It is not easy to solve. Youngsters, many are going abroad. They do not want to work in India. Then those in one TPA will migrate to another TPA. They have their own leave issues and such other issues that all businesses face. That is a reality, and understanding that reality is a must. Another thing, a change. Now the commission paid to the TPA is fixed at a certain percentage. That should change. That should be based on overall expense management. That is a scientific method. Overall expense management based remuneration is on the anvil. It will be introduced in a phased manner at the earliest. Then coming to what we face often. Most of the hospitals we go to are network hospitals, but there too, the type of reception we receive, the patient receives, varies considerably. At the same time, recently, I was hearing to a talk by the famous surgeon, Dr. Jose Piriapuram, in which he mentioned that conditions in India, when compared to America, England, and European countries, the hospital conditions, the treatment quickness, it is unparalleled. India cannot be beaten in that. We have a very responsive team for medical care. That was what he was telling. After he has worked abroad, he has worked in India, he has done a number of operations, and he's an expert on that matter. His final conclusion is that in India, the facilities are much better than obtaining outside. That's the thing we should appreciate about the health scenario in India. Maybe we can say many other negative things like GDP percentage is much less and things like that. The allocation to healthcare is less. But it is very easy to find out negative, to make negative comments. But it is very difficult to find a solution to all this in a proper way. Some hospitals welcome TPA services and the patient. They welcome a patient having a insurance card, because as I was speaking recently to the director of a major hospital, he told me, you have nothing to worry. If the person is insured, he has a card, we will treat him. You don't have to go after him for getting the money that is required. We don't have to run after, we don't have to arrange finance. If the patient has an insurance card, he is very much welcome, and we'll give him the best treatment. At the same time, we will try to treat his ailment and send him home at the earliest. Earlier, there was talk about hospitals retaining patients so that the hospital remain occupied. Now, none of the major hospitals have such issues. They want the patient to leave the hospital at the earliest, and they want the patient to have insurance. But this is one positive aspect. There are hospitals which do discourage insurance to a certain extent. That is because of lack of knowledge about the procedures, lack of facilities, and many other issues which cannot be mentioned in public. See, hospitals, have various types of insurance help desks. Some in major tertiary, major hospitals, the insurance help desk works 24 hours. They have no issues. The team, normally major hospitals, they have a very good insurance help desk team with a positive attitude and a friendly attitude. But it is not compulsory that you will face the same pleasing attitude from all hospitals. There are hospitals who want cash payment, immediate payment. They say we cannot run after the TPA. We cannot. We don't have time to answer the queries. We don't want their interference in our affairs, and such other issues. The basic fact is that they don't want to be monitored. They want freedom. That could be the reason. And many such hospitals, their help desk is manned by underqualified or maybe not properly qualified or people with a totally positive attitude. They open the office at the insurance desk at 9 a.m. say and close and go home by 5 p.m. Their issues will arise because settling the bills will take time and there should be somebody at the insurance desk. Otherwise, the patient will have to stay back for another day till the office opens the next day. These are all quality issues, and there will be many opinions on such things. Many in favor, many not in favor. You can very well say some hospitals are overcharging. Some are not charging that much. That is an endless controversy. There's no end to it. But I have seen from practical experience. I am basically from Cochin. All the major hospitals in Cochin, all the major hospitals, I mean, render excellent service to the insured, provided the insured is also alert, or at least if it's a patient that the bystander is alert and deals with all the problems as and when it arises. Final advice I would like to say to the insured is that I'm progressing towards a conclusion. I have said it earlier. Stop unnecessary correspondence with the third-party authority. Take up all issues simultaneously and try to get it settled, not one by one, because that will create an impression. It could be due to genuine reasons that these institutions are not being properly run. That need not be a correct judgment. And immediately, in case you have having issues with the TPA, escalate with the insurance company, escalate it in a legal way, and try to get redress. Even today, I was very happy to know that the insurance ombudsman at Cochin gave a very favorable award to an employee known to me. I had dealt with the issue. My friends also were involved. They also took a lot of strain. But with the intervention of the insurance ombudsman, the insured got around more than 2 lakhs as a payment. This is not restricted to this particular issue. With correct knowledge, I will say with exact knowledge, if we interfere and try to help those who deserve help, not all patients deserve help. They have their own resources, but those who require advice, help, if they are given that advice and help in a timely manner, maybe crores and crores of rupees we have been able to get from awards passed by the insurance ombudsman. The field is very large. The TPA, it cannot be covered in a short time, but this itself took a long time, I think. Please do excuse me. Thank you for the patience in hearing me out. By Kumar Menon. Thank you.